Hey everybody, welcome to the third and final video in this three-part free video series on ligamentous articular strain technique. In this video, we're going to show you a treatment technique for the respiratory diaphragm. Now, a lot of people have dysfunctions in the respiratory diaphragm that they're completely unaware of. They may have low back dysfunctions, they may have breathing dysfunctions, they may have tension and pain in their lower back or even down into their hips. So here's a technique that is great in order to help your patient regain proper posture and proper breathing techniques. With your patient lying in the supine position, we find the respiratory diaphragm, which is located right at the xiphoid process at the end of the sternum, and actually further above into around rib 5 and 6, then a little bit higher than what you would have anticipated. So what we need to do is assess to see how this diaphragm is functioning. And all we need to do is just have the patient take a deep breath in and a deep breath out. And what you'll notice is that when she takes a deep breath in, there's a little bit of a dysfunction in the fact that one side of the diaphragm contracted faster than the other side. And also when she exhaled, there was a direction of ease with the left side of the diaphragm loading in to the midline of the body. So now that we know where the dysfunction is, we're going to have her take a deep breath in, and we're going to have her take a deep breath out. And as she exhales, I'm going to load my hands down towards the table and in towards the midline of the body, following the direction of ease to the end point. When we get to that end point, she's just going to breathe normally, and we are going to resist the motion of that respiratory diaphragm. Essentially, we're disengaging the dysfunctional movement pattern of the respiratory diaphragm and taking it back to a neutral position where it can reset and start to engage in a more functional pattern. One thing you can notice while you're treating the respiratory diaphragm is you can feel to see which lung fills before the other one does. If, for example, we have her left lung that fills quicker than her right lung, simply have the patient just concentrate on filling the right side lung first. As soon as they do that, you will notice an immediate change in the contraction of the respiratory diaphragm, at which point the direction of ease will change once again. Reposition by loading a little bit deeper into the table, a little bit more towards the midline, taking up the slack. And once the tissue has released, it will feel quite balanced between your hands. Have the patient take a deep breath in as you slowly come off and exhale out. To reassess, load back in, look for the initial direction of ease on the left-hand side, which is no longer there, and come back out, take a deep breath in. The respiratory diaphragm now contracts equally on both sides and relaxes on both sides. And that concludes the treatment technique for the respiratory diaphragm. I hope you enjoyed all three videos in this three-video free series on ligamentous articular strain technique. I hope you've benefited from this, and I hope you try these techniques with your patients. And if you like the information that was provided to you in these treatments and in these videos, I would love to see you out at one of the live events or the courses that we teach, where we go into far more detail as to how you can utilize your skill, your expertise, and your treatment techniques in treating the ligamentous articular system. Thanks for watching, and I hope to see you out at one of the courses.